Disease burden of primary biliary cholangitis and associated pruritus, based on a cross-sectional U.S. claims analysis. One of the most prevalent symptoms of primary biliary cholangitis, or PBC, is pruritus. With few treatment choices, it has a detrimental influence on quality of life. The study's goals were to discover unmet needs in PBC patients and define the burden in PBC patients with and without pruritus diagnosis. The study was a retrospective cross-sectional database analysis that examined the incidence of pre-specified comorbidities and drugs through an indirect standardization technique. The PBC population and the PBC pruritus subpopulation with non-cases were the subjects. Participants were over 2,000 PBC patients and 140 PBC pruritus patients. When compared to non-cases, both groups reported considerably greater rates of fatigue, depression or anxiety, and sleep-related difficulties. Diarrhea was the most prevalent symptom of interest in both groups, with a prevalence of at least 3 times of the non-case population. In general, the PBC pruritus subpopulation had a greater frequency of comorbidities and medication use than the PBC population and non-cases. Given the accessibility of PBC therapies, the PBC cohort exhibited a greater comorbidity load than in non-cases. This burden was greater in the PBC pruritus subpopulation, where sleep problems and depression or anxiety were more prominent. Considering this, pruritus remains undertreated, underscoring the importance of cholestatic pruritus-specific therapies.